OK, an estimated 50,000 Scots suffer from ME, causing extreme tiredness that can leave them bedbound for months or even years at a time. But campaigners are warning that services available to them are at rock bottom following the death of the country's only specialist nurse.
Yes, the Scottish Government says it's committed to creating a more equitable service for those with ME, also known as chronic fatigue syndrome. The charity ME Action says there are only pockets of provision based on outdated models of care following the death of expert Keith Anderson last year. Now, earlier I spoke to Karima Rahman from the organisation. She herself lives with the condition.
ME is a profoundly debilitating, complex disease that affects multiple systems within the body. And there's still a lot that we don't understand about exactly what's happening when someone is suffering with ME. And that's because we have such a lack of research that hasn't been done to truly understand what's happening to us with the condition. There are a myriad of symptoms which different patients experience to different severities. And so chronic fatigue is one of those symptoms that you will hear spoken about because it is also known as chronic fatigue syndrome. And by fatigue there, we don't just mean tiredness, we mean a complete lack of energy. So what people will often liken us to is it's a bit like having a broken battery on your phone when it gets old and you keep charging it and trying to plug it in, but whatever you do, it doesn't really get beyond 30%. And even if it gets a bit higher, it's going to slam quickly down for no reason at all. So people with ME also will experience, potentially, depending on the way that their symptoms look, pain, headaches, migraines, all sorts of different symptoms. And the key thing with ME is that we experience something called post-exertional malaise or post-exertional symptom exacerbation. And what that means is a small exertion of energy, relatively, can lead to a delayed increase in symptoms. So, for example, I live with mild ME myself, and I'm very well by our community standards, so I'm able to do this with you now and talk to you. But in a day, 2 days, my body will start to feel the effects of that, and I will start to have a symptom flare as a result of that. So it can be very hard to see visibly how a person is living with ME.
What are your main concerns then when it comes to this lack of a specialist in Scotland? Will we see our GPs having to pick up the slack and have more patients presenting with potential ME symptoms in the future?
Absolutely. So sadly, we have seen, and we are continuing to see, a huge increase in people living with post-viral complications and ME or ME-like symptoms in the wake of the COVID-19 pandemic. And GPs don't have anything that they can do with these patients helpfully when they present. So the healthcare education and training at the point of primary care is extremely important. We do need GPs to be more understanding of what this condition means and the different things that they can do to help to support people with day-to-day management. But what they also need to be able to do is refer on to a specialist team. And that was what Keith was able to do, is hold that for that patient, but say to them, actually, we need to get you to see a neurologist. Actually, I think that it would be good if you could talk to an endocrinologist. These different specialisms that we would expect patients living with a chronic complex illness to be able to access, that just doesn't exist in Scotland right now. And so your kind of best case scenario is a really lovely GP who's very kind to you and sits down and says, I believe you, this is really, really hard, but there's nothing I can do. And that is still an awful scenario to be in.